Dedicated to sharing the Bronx's diverse history, culture, and architecture, and is a licensed tour guide and advocate for Bronx parks. Nilka, would you please come up? Thank you so much. And Catherine Nagel, who is the Executive Director of the City Parks Alliance. City Parks Alliance empowers a broad-based constituency to advance park programming and funding strategies for more equitable, vibrant cities. Under her leadership, City Parks Alliance has recruited mayors to increase federal funding for urban parks, resulting in $1 million plus for distressed communities. Commissioner Mitchell Silver, elected to Planetism's list of the 100 most influential urbanists in the world in 2017, is an award-winning planner with over 30 years of experience. A past president of the American Planning Association, he was appointed Commissioner of New York City Department of Parks and Recreation in 2014. And Elva Yanez, who's a Director of the Health Equity at the Prevention Institute. She focuses on public policy initiatives that emphasize environmental approaches to prevention and health equity outcomes in Los Angeles. She's applied her expertise to address park inequities, environmental impacts, land use, and health disparities in underserved communities. Elva previously served on the California State Park and Recreation Commission from 2011 to 2019. And we look forward to your questions as well. So welcome, panel, and I am so sorry that I abused the time, and Commissioner Silver especially, I apologize to you. I know you need to leave at 11. Let me start and jump right into questions, actually, because Commissioner, you are, it's not typical for a commissioner to necessarily be a planner, is that correct? You come from lots of different backgrounds. And so it's actually special for New York to have you. And tell us, being a planner, what special perspective does that bring to this, and especially when it comes to the connection of parks and health?
Well, as a planner, you really are what I kind of call a doctor of a city. You have to understand what makes it function, and parks don't sit in isolation. They're connected to so many other aspects of a city. You mentioned mental health, but it's also the economy, it's also livability. And so having a perspective as an urban planner gives you a broader understanding that it's not just about these green spaces that sit in isolation, but how they connect to the overall city. The mayor himself, when I was in for the position, said he was looking for someone with a broader vision, not just someone who just understands how to maintain parks, but in the 21st century, parks mean something very different. It's not just these green spaces. They're now our first line of defense in climate change. As you mentioned, in terms of our tree canopy, air quality, water quality, heat island effect is broader than just these places you go to. And so that was something that intrigued me, and I'm very pleased the mayor recognized that. And as a result, we're able now to reach out with other city agencies, the Public Health Department and Planning, Department of Environmental Protection, Department of Transportation, and rethink the public realm, rethink the purpose of our parks. So that, in my opinion, I believe what a planner brings to this position.
Wonderful. And you have also introduced me to this concept of parks without borders. Is that exactly what you're describing there? Is there another piece to that as well?
No, it is that working in other places and traveling around the country, coming back to New York, I always wondered why, growing up here, there were all these high fences. Wanted parks to be more accessible, more visible, and so we started to think about how parks can connect to the rest of the neighborhood, and how in some cases, fences and walls limit the ability for someone to enjoy their park. Plus, Olmsted said that the sidewalk is the outer park. He wanted people to understand that parks aren't contained behind these frames, and so our whole city should be a park. So we have green streets, and rethinking our sidewalk as bioswales, that it could people could feel the green throughout. And so we launched this program called Parks Without Borders. Other agencies are on board. Where people see a street, I see a park. And so as a result, we're beginning to transform our entire public realm. 14% of New York City is within parks. 26% are streets and sidewalks. 40% of New York City is in the public realm, and we no longer want to silo that within departments. We want to look at our entire public realm as a public asset and make it as green as possible.
Wonderful. So we're very lucky to have local expertise and also expertise that is from other cities and a little bit more national here. And Catherine Nagel actually was involved in a big study that we're all looking to that was funded by the RAND Corporation to look at how parks can encourage more physical activity and exercise. Catherine, tell us, what were the surprises from that study, things that we here in New York City we might want to hear about?
Sure. So we looked at 174 neighborhood parks in 25 cities around the country. And those were parks between 2 and 20 acres. So the parks that we've seen examples of in the videos today, to really understand how they were programmed and designed to either encourage or discourage physical activity. And what we found is that, one, programming matters. The parks that were programmed were the parks where we saw the greatest amount of physical activity. However, in those parks, we saw that the programming was not for everybody, that there were more boys than girls. In those parks, that the teen girls that were participating in sports were 4% of park users, and teen boys were 38%. We saw in those parks that even though when they were well programmed, seniors were not active. Seniors represent 18% of our national population, and only 4% of seniors were in these parks. So I think in general, we see a great opportunity for increasing programming to get people active. We also saw that design matters, and where people were getting the most amount of physical activity were in the walking loops. And yet, less than a third of our parks, our neighborhood parks, actually have walking loops. So there are some opportunities for fairly low-cost interventions to provide opportunities for people to move. Lastly, we saw that marketing matters. In the parks where there was good signage, where there was communication about the programming. I know New York City has done a great job in introducing new signage, but just communicating to the public in one way or another about what's happening in the park, that also contributed to a higher level of physical activity.
Wonderful, wonderful. And Elva, I want you to tell us what wisdom you bring from Los Angeles, because I know that there's been a lot of exciting things going on there with parks, but any actual thoughts in terms of increasing access for seniors and women would also be really welcome, hearing that is a...
Here in New York. Los Angeles is one of the most park-poor large cities in the United States. And so a lot of our work focuses on parks as a social determinant of health. And as such, equitable access really is the key to creating the benefits or extending the benefits of parks to underserved communities. So most recently, we've been involved in a parcel tax that created $94 million a year for parks and open space in LA County, with a set aside specifically for park poor areas to increase the amount of park space in those geographies. And there's been studies that show extensively that those communities that lack parks and open space are the same communities that have high rates of things like cardiovascular disease, diabetes, childhood obesity, and premature mortality related to those. We're doing a study with UCLA School of Public Health to look at life expectancy related to park access. And I think that's a new area that really sort of tries to get at the precise interrelationship between the health benefits of parks and population health. We work at the population level, so a lot of our work on parks focuses on the land use aspects of them, and that's where I think why I was invited here. Parks are a land use issue, and land use is another determinant of health. We need to have good land use policies that covers parks and open space to ensure the health and vitality of our communities, not only in Los Angeles, but everywhere. And thank you. So I think that just making those connections between parks, land use, and population level health, and the importance of policy and systems change to ensure that people have access and that the parks that we have are of high quality. We know from the life expectancy data that's already out there that the quality of the park is extremely important to its impact on life expectancy. So the struggle here, the fight for light, is totally connected to those issues.
Wonderful, and I want to hear more about the specifics in terms of quality. But Nilka, nice to meet you. And I actually wanted to ask you, you have a really interesting role in that you kind of bring all these pieces together. You work on policy, but also very much through an experiential lens, and you're also a tour guide, is that correct?
I am.
For the Bronx. So tell us how being a tour guide helps with the advocacy and the policy piece, and tell us about some of the challenges that you're facing in your neighborhood.
I think most of our parks here in New York City, particularly in the Bronx, they're full of history. You know, down to the name of the park. It could be, you know, you just call it the name of the park and you have no idea why the park is named that. So usually we start with the name of the park. And then we think about most of these parks were built during a time where Robert Moses was the commissioner. A lot of these parks are adjacent to highways. So when we think about parks, and I think you touched on it earlier, we all define parks in different ways. For us, I've lived across the street from Virginia Park my entire life. Virginia Park was a fenced-off green space. So when you think about a park, right, you think about access to a park, you think about sitting in the park, relaxing in the park, but it was not that kind of park. It was a green space that you looked at. We were fortunate enough that both of our parks, Virginia Park and Hugh Grant Circle, were selected for the Parks Without Borders initiative. We just broke ground earlier this week. For us, that reconstruction is receiving two new parks. You touched on something which I thought was really important, particularly during this time in New York, and that's gentrification and parks. Most of our neighbors, we were able to mobilize. We do community building through the use of parks. So we look at these green spaces and we activate them. They become gathering spaces. We want to know what the community is thinking about, you know, what's going on in the community. Particularly in the Bronx, we rank 62nd as the unhealthiest county here in New York. So we look at these gathering spaces and we really use them to go out there to walk, to do stewardship. You know, you were talking about planting. All of these things are very important, but we are at a particular time where most of our neighbors are very excited that these parks are being reconstructed. But we do have neighbors that are very concerned with, okay, well, there's a $9 million investment. What does that mean for us long term? Are we going to be able to stay living here? A couple of years ago, if you would have asked me, I would have told you absolutely not. But maybe a year after it was announced that Virginia Park and Hugh Grant Circle was selected for the Parks Without Borders, a developer came and bought the piece of land that's right across the street from Hugh Grant Circle. So all of these issues, you know, they're all intertwined. You know, for us, it was about getting kids out to the park, having them develop that sense of ownership, and then from that sense of ownership, getting them into advocacy work, right? But all of these things it is complex, to use the word, to describe it the way you did. While for me, parks are as critical for New York City as having hospitals or libraries, the community does have to have this ownership over these parks, because if not, things do start happening.
And Commissioner Silver, do you have some ideas to go along with that, or response to that? I see you. Yeah.
The administration itself is looking at the bigger picture about how we deal with the issue of changing neighborhoods and gentrification. But it's a very difficult choice. There are neighborhoods that have been neglected for 20 years, and people are saying, why have you forgotten me? You've neglected me. When we decide to invest in that park, now they're saying, now you're gentrifying me. So it's a very difficult line to walk, because there are many parks. Becoming on commissioner, we have this equity initiative of focusing specifically on parks that are being neglected, The majority of the neighborhood is grateful and are surprised that now their park's getting attention. But there are others who are saying, no, you're purposely coming in here to gentrify us, which is not the case. It's a reality we have to deal with. There's a report just came out at the University, I believe, of Utah. It was posted in City Lab that said in some cases it is true. High Line, the 606, the Atlanta Bell Line, they are seeing a direct correlation to gentrification, but they don't see it as much in your typical neighborhood park. The fear of gentrification is so huge that people default to that improved park leads to gentrification. That was not proven, and that's not always the case, but you can't dismiss that fear. What we try to do is make sure that if that park is neglected, I have a difficult time, if it's been 20 years, of denying yet another generation of a quality space. So I'd rather improve that space and deal with the other issues working with other agencies, because I feel it's just unfair to have yet another family go through another 20 years of having an inferior park.
The same issues are happening in Los Angeles with gentrification and displacement. And the way we are trying to handle it is to look more holistically across agencies and investments. Right now we have a plethora of investments in infrastructure in Los Angeles County, over $1 billion a year from recent measures in parks, transportation, housing, and stormwater. And what we have advanced is multi-agency collaboration to advance things like displacement avoidance policies. But at the end of the day, these are structural issues that have to be addressed further upstream so that we are addressing the lack of park space and the degraded park space along with affordable housing. We can't get further along unless there's, very upstream structural change in the systems and policies that control our urban spaces.
And there's a great example in Washington, D.C. There's a proposed project called the 11th Street Bridge Project, where we'll be linking two parts of D.C. that have very different backgrounds, very different rates of home ownership. And what they're doing there is they're putting in policies before they build the park. So they're putting in policies for existing residents to be able to buy homes. They're supporting small business development, and they're also putting in policies that would provide employment opportunities for existing residents as part of the park development. However, to Mitch's point, that means that the park is not going to be developed for another 10 years. So there are all these trade-offs, but I think every city, every large city that's experiencing a lot of growth is grappling with this. I will say I was at a conference where somebody from Erie, Pennsylvania, spoke and said, hey, I would love the issue of gentrification because they're just trying to attract any kind of investment. So there's the real difference between the size of cities.
That is not an issue in New York. Yeah.
When you saw the clip on We Run Brownsville, did you see the condition of the track? It was the worst I have seen as commissioner. And I went out there to run one day with the group, and I could not look down without thinking I'm going to trip. Now, we're now investing $30 million in Betsy Head Park, $10 million specifically to redo the track. We're doing it because of equity and how bad it is. But there are some going to say, wait a minute, gentrification. So here's the dilemma we have to deal with. If you want to leave that I would say tripping hazard, a very carefully, a challenged track, because it's somewhat of an obstacle course that you have to run through, that to me, now they participated, We Run Brownsville, and the community participated in the scoping sessions for that brand new park. They couldn't be more proud, but I'm sure there are some that don't believe bringing that up to world-class level could lead to gentrification. And I'm saying I'd rather provide that quality space and make sure that that group and others have a public space they could be proud and be healthy.
And
oh, by the way, please don't eat our parks. We have edible gardens. I'm just joking.
I know, but that was growing on the sidewalk,
park.
and it was a weed. You didn't want it in your park. Right?
No, okay.
But I didn't have it for breakfast. I promise. But it occurs to me that actually this meeting very much exemplifies the kind of gentrifying proof initiatives that we need to have, a convergence of an art society and a park society in a medical building. I don't know if anybody here is representing healthcare or medicine. Are there any folks here? But those kind of convergences. And that is a question that is coming up a lot on my iPad that I want to ask you. Apparently, I really triggered something when I put up those numbers of how much we spend on healthcare versus parks. And it really is a question to all of you. Are there examples of some of those funds being diverted, or at least that argument being used for investing more in parks? Do any of you know of examples like that?
In Los Angeles, we have a developer impact fee that offsets impacts on parks. And that is called the Quimby law. That's a state law, and each city can do their own version of it. In Los Angeles, it hadn't been improved for 40 years or so. And the radius of where that money could be used in relationship to the development was very, very small. So it couldn't be used to impact adjacent lower income communities that had huge park need. So the advocates in Los Angeles worked to extend that further out, the radius of the amount that could be used, and diversify what they could be used for. So we think that there's, that interconnection again between land use policies related to development and improvements in parks. And one of our big efforts now is to bring in the county public health department into all of these efforts, because they bring a level of rigor in terms of scientific research and evaluation, all of which are really important to quality, viable parks, including things like health impact assessments related to issues like lack of light.
Well, I want to first commend Lynn Kelly, New York City Parks, Pam, and all the other Playfair campaign. Your 2019 numbers may change. That campaign, Playfair, gave the Parks Department additional $43 million to our budget, was unprecedented. And so those numbers, hopefully, okay. I don't know how that measures out with 8.6 million people. May go up a few dollars. But there's no question that I would never say no to additional funds. In terms of New York, clearly the city is growing, the desire to build more affordable housing, and to the mayor's credit, created a neighborhood development fund. So when we do a rezoning, one of the issues on the table is how do we increase or improve public space? And that is something that is part of every conversation. Every rezoning, our department is at the table as those conversations continue. So it gives us the ability, as you increase more density, you certainly want to improve and expand public space. So it may not be an impact fee per se, but we recognize the importance that density and open space must go together. It's not just about affordable housing, it's about quality neighborhoods, and open space gets you there.
On a very grassroots level, what we're able to do is when we have new buildings or we have new businesses that come into the neighborhood, through friends groups, we negotiate with them. We let them know, hey, a friends group is, for those that don't know, it's usually just a group of neighbors that come out and they adopt a particular park and they do stewardship and they do programming into those parks. Most of those people are not paid. You do have larger friends group that might have a salaried employee, but for the most part, friends groups are just people in the community that get together and really volunteer and advocate for their park. But most of those friends groups, either if they don't have a 501c3, they'll be able to get a fiscal conduit. But we do a lot of work, and when we see change in the neighborhood, we introduce ourselves, we let them know the program that we're doing in the park, what it is that we're trying to achieve, and we do work with them to kind of get some additional funds for particular parks.
And do you know of any examples, Catherine, where healthcare dollars are literally being diverted in certain ways?
I think the way that we look at it in terms of advocacy, looking obviously for more funding, and we're seeing examples of, there's a Vermont hospital that's contributing more to programming. I think Jefferson Hospital in Philadelphia is actually sending out mobile units into parks to help people get just their checkups and that sort of thing.
And Kaiser in California
Yeah,
is
it
doing
does
the
that
same.
sort of thing. But I think also on the cost savings side, we need to have that discussion. We spend, the U.S. adults, I think about 50% of U.S. adults suffer from some sort of chronic disease, whether obesity, heart disease, diabetes. We spend annually about $500 billion annually just on those three health challenges. And so I think part of the conversation should be, you know, with investment in parks and places where people can get healthier, how can we actually find cost savings from the public health budgets? And so I think that there's lots of opportunities there. We've just completed a study that was funded by the Robert Wood Johnson Foundation, which is a national scan of all of the ways that cities are finding funding for parks for equitable investment. So I don't want to go into all of those ways, but if you look on our website, you can see that there are many ways that cities are tapping into adjacent sectors to help address some of these health challenges.
Wonderful. I'm getting a lot of questions about sunlight too, because that is the theme of today. And I have to say that from California, this is a little bit less of an issue, even in San Francisco, though we are becoming New Yorkized in terms of our skyscrapers and so on. But this difference between daylight and sunlight and shade and shadow and how all these things impact your experience and health in New York. I would love to start with you, Commissioner, here. Just, I know as a planner you have a lot of opinions on this, and yeah.
Well, first we do offer different experiences for our park users, and I do differentiate sunlight from daylight. And then there are some people that are nocturnal and enjoy our public spaces at night. And so we offer those choices. We have close to 2,000 parks, and people can choose the type of experience they want. As we survey the parks on hot summer days, there are some that are sunbathing on sheep meadow, but there are others that immediately gravitate to the shade of a tree. And so we just want to make sure as we build our park system, we offer their choices. There are some that are very sensitive to sunlight, and so there are places they can go that have the comfort of shade. There are others that enjoy the sun, and we make sure there are parks that they can access to enjoy it. So from our perspective, we just make sure that we offer that variety for people to enjoy. And in some cases, if it is not a place that has a lot of trees, or if we have, in terms of our slides, we have to put up warnings that some of these elements can get heated. We do make sure in terms of heat-on effect that we have a very strong urban canopy to keep our city cool, all the things you mentioned in your presentation. But the bottom line for us, we do differentiate sunlight from daylight as well as darkness. And we just want to make sure we have a great park system that people can customize and choose their experience based upon their attraction to sun, to night, to light, and to shade.
I think the lack of sunlight could impact the quality, the perceived quality of a park, and that in turn could impact the health benefit of that park. And across the board, I think that this policy issue that we're talking about here today, really that's where the connections can be made in terms of the quality experience that people have in parks that were designed to experience sunlight, and how that impacts the health benefits associated with that particular park.
In the Bronx, in your neighborhood, has this come up as a particular issue, and what are the solutions and proposals that are there?
While the sunlight is important, the trees are, I mean, we have a lot of people that come out, especially seniors, and they'll look for those trees. And if we're hosting an event that doesn't have mature trees like Starlight Park or Concrete Plant Park, which are along the Bronx River, those are trickier for people to come out. You might have, you know, younger crowds, but when it comes to people that need that shade because that tree canopy is just not mature enough, you know, you do get, you know, just a group of people that won't show up. So it is important to have that balance of having sunlight, but also having mature trees that provide that shade.
And is there a workaround as we're starting to develop new parks? You can't get the Insta-tree. So how are we doing this?
People are doing portable by bringing umbrellas.
I see.
They have shade structures.
Yeah.
You go to a lot of our parks, people are strolling with umbrellas. But we do offer, like I said, good healthy canopy. We do have shade structures we're building in, not all. We just opened a park yesterday near Coney Island, Lafayette Playground, and we did have a shade structure. Because the trees, it was an asphalt Robert Moses playground.
Yeah.
We put in very small trees. Will take some time for them to grow, but did this very attractive shade structure with seating tables in the center of that park.
Wonderful, wonderful. And Catherine, in the RAND study, or just in general in your experience, what are some ways that sunlight versus daylight has played a role in sort of encouraging or discouraging park access?
So we didn't look specifically at light. We did look to see if there was a connection between the tree canopy and physical activity. We couldn't find any specific correlation, either positive or negative, around that. We did then look at some of the playgrounds to see if there were shade structures there. Again, it was not conclusive. But what I will say, and how important this conversation is, I mean, I don't think that the national parks community has really addressed the idea of light as a design component, or as just an essential component for how parks can be the best that they can be. And I think in many cities, Phoenix is seeing more and more 120-degree plus days. So what does that mean for how parks are going to be used? What does it mean for when people are going to be outside? And how do we deal with just a changing environment and adjust our lighting regime as a result?
Absolutely. I was getting questions before about the number of trees in general. I guess I triggered something with the car to tree ratio. And please illuminate us here.
We don't know the number of private trees, but we do know that there are over 670,000 street trees and over 2 million trees on parkland. The balance, and I guess that's where it's coming from, is on private property, but we just know the number, but it's a good question. I was intrigued as well, but I do know it's close to 3 million of trees on city-owned land.
On city-owned land. So the 7 million number I got maybe was a little hopeful. It was
it's possible. We have hospital campuses. We have,
right.
So it is quite possible on private land that could make up that difference.
Right, because it seems to me that is a wonderful way to sort of track the vibrancy of the city and protecting it from climate change. I have a question for you there, actually, in terms of this idea of conservation and land stewardship for all of you versus parks for people. I mean, there is a tension there. I showed the issue around the hickory tree, where that had to do with the allergies. But we run up against this a lot. A lot of times, space that we're using for people doesn't potentially have all the biodiversity it needs to, or that the plants aren't protected in the way that they could do the maximum in terms of ecosystem services. Is this something that all of you run up against, and how do you weigh people versus nature in those situations?
We do it in two ways. Within our 30,000 acres of parkland, 10,000 of it is exclusively natural areas. And whether it's Pelham Bay, Van Cortlandt, we have these natural features that we have an entire team that focuses just how to preserve those natural areas and diversity. We're now seeing an explosion in wildlife in parks. Not everybody likes it, from deer to raccoons. You go to Central Park at night, they are there. It seems like they're telling you to get out of their park. But we're now seeing, with the result of a focus on our natural areas, that we are seeing a change across the board on our natural habitats. So it's something that we cherish. We know we have to have that balance. And if I showed you photographs of some of our natural areas in New York City, whether Queens or Bronx or Staten Island, you would say you were not in New York City. And so it's very important that we keep it healthy. We have both partners. Natural Area Conservancy is here, that's a partner. We have our own natural resources group, because we understand the value of enhancing that diversity by making sure we have those natural areas preserved and conserved for present and future generations.
Wonderful. And Commissioner, I know you have to go, but are any other comments related to that or anything else we've discussed would be wonderful.
I think the idea of public education is just critical, and the cities that are being successful in changing the way that they're maintaining their parks for greater biodiversity are the ones that are providing the best information to the public about what that means, and using that as an opportunity to get more civic engagement in the parks.
And is that?
I agree. We had the Million Tree Initiative here where, a million trees were planted, and that's actually how we started our work. We did a block beautification in our project. We had 10 street trees that we didn't have before, and we decided to go out there and, take a tree care workshop. And most of the people in the area where we lived were just excited, and they were like, hey, we want to do that too. But as the years have passed and the trees are mature, and now they're, they've been there since 2011, now they're like four stories tall. And there are some people that complain, but the education is a key factor, really explaining to them the benefits of a mature tree, especially property owners, and then when you educate them on that, they're like, oh, okay, because they usually see it as, oh, this is going to be an expense for me, the concrete's going to lift, it's going to wrap around, the sewer pipes of my septic tank, and, but I think that education is a key component to it.
Wonderful. And from LA, or is it, I'm sure this is tension.
Investments right now, 300 plus per year for at least 30 years. And a lot of those investments are going to be directed to green infrastructure as opposed to gray infrastructure. And a lot of that infrastructure will happen in low-income communities of color that lack park space. And that infrastructure will mimic nature, trying to increase the biodiversity associated with things that, capture cleansing and reusing water.
Wonderful. And what have you run across in your travels and seeing, how these two needs are balanced? Is it?
Yeah, I think again it is it's around that communication. I mean, as we increase the green infrastructure, is that impinging on the space that people are expecting to use for recreational purposes. So there's, with every new solution, there's a new challenge that comes with it. But I think it gets back to the importance of working closely with the community and making sure that people understand that there's a need for many things, and we just have to find a balance.
Wonderful. Well, this is just the beginning of an exciting day. So thank you all very, very much. I really, really appreciate it.